প্রিয় দর্শক সবাইকে শুভেচ্ছা জানিয়ে শুরু করছি এটিএন বাংলার সরাসরি সম্প্রচারিত নিঃসন্তান দম্পতিদের নিয়ে বিশেষ অনুষ্ঠান মিট দ্য ফার্টিলিটি এক্সপার্ট রিয়ালাইজ ইয়োর ড্রিম। সঙ্গে আছি ডাক্তার শাকিরা নোভা। স্বামী বিবেকানন্দ বলেছেন, চিন্তা আর চিতা দুই এক, তবে চিতাটা ভালো, একেবারে পুড়িয়ে মারে, আর চিন্তা জ্বালায় সারাটি জীবন। কিছু কিছু অসুস্থতা আমাদেরকে ফেলে দেয় চিতা সম দুশ্চিন্তায়। এগুলোর মধ্যে অন্যতম হচ্ছে ইনফার্টিলিটি বা বন্ধ্যাত্ব। প্রিয় দর্শক, আজ আমরা পুরো অনুষ্ঠান জুড়েই কথা বলবো বন্ধ্যাত্ব প্রসঙ্গে। এ বিষয়ে কথা বলবার জন্য ভারতের চেন্নাই থেকে আমাদের সাথে সংযুক্ত হয়েছেন ডাক্তার রামাইয়া রামালিঙ্গাম, গাইনোকোলজি, অবস্টেটিক্স অ্যান্ড ফার্টিলিটি স্পেশালিস্ট। প্রিয় দর্শক, শুরুতেই আমি ডাক্তার রামাইয়া রামালিঙ্গামের পরিচিতিটা তুলে ধরছি। ডাক্তার রামাইয়া রামালিঙ্গাম একজন সুপরিচিত গাইনোকোলজিস্ট এবং ফার্টিলিটি স্পেশালিস্ট, যিনি ভারতের চেন্নাইয়ের জীবন মিত্র ফার্টিলিটি অ্যান্ড উইমেন কেয়ার সেন্টারে কর্মরত আছেন। তিনি ভারতের প্রথম সারির ফার্টিলিটি এক্সপার্টদের মধ্যে অন্যতম এবং ক্রিশ্চিয়ান মেডিকেল কলেজ ভেলোর থেকে ইনফার্টিলিটি বিষয়ে প্রশিক্ষিত। তিনি বাংলাদেশি দম্পতিদের মাঝে ভীষণ রকম জনপ্রিয়। জীবন মিত্র সেরা ফার্টিলিটি সেন্টার হিসাবে মেরিট অ্যাওয়ার্ডস গ্রুপ কর্তৃক পুরস্কৃত হয়েছে। তিনি 10,000-এরও বেশি বাংলাদেশি নিঃসন্তান দম্পতিদের মাতৃত্ব এবং পিতৃত্বের স্বাদ গ্রহণে সাহায্য করেছেন। তিনি পৃথিবীর বিভিন্ন দেশ থেকে আগত জটিল রোগীদের চিকিৎসা সেবা প্রদানের জন্য সুখ্যাতি অর্জন করেছেন। চলুন দর্শক, কথা বলি আমাদের আজকের অতিথির সাথে। Hello, Dr. Ramalingam.
Hello, hi, ATN Bangla viewers, namaskar. And thank you, Dr. Nova, for your kind introduction.
Okay, welcome. You are most welcome. And we are going to start our discussion. We are very happy to have you with us. At the very beginning, I would like to ask you, what is the reason of increasing fertility issues?
See, as you correctly told, the fertility issues are day by day increasing very rapidly. It can be viewed in two ways. One is, as such, the problem is increasing, and on the other hand, the awareness among people is increasing. Previously, people were not that much aware, but now, after 1 year or 2 years of marriage life, awareness is there, so they are seeking medical help. First point which I want to discuss further is regarding the increased incidence of infertility these days. Why is it happening? Because previously, before 10 years, 20 years, we hardly see 1 or 2 couples with this problem. But now, almost every family has a couple who has difficulty in conceiving. Why is this increasing so much? This is a concern question now. The main problem is the changing lifestyle. Because we are not like before, like 30 years, the life what we live is not like now. So what happens is increasing weight gain. Many of them are obese. We are not maintaining the ideal body mass index. We are all overweight. And lot of stress is there in our lifestyle. No physical exercise, no hard work. So everyone is sitting in one place and doing computer job like this. So because of lack of physical exercise, increasing weight gain, eating habits, that is the main thing. We eat lot of junk food, carbohydrate diets. So all these stress, night duties, smoking, all these has changed our total lifestyle. So now this problem is increasing very rapidly.
Thank you, Dr. Ramalingam. You explained it very nicely. And the next question is, when should a married couple go to a medical evaluation?
Okay, so first, after marriage, when you are trying for 1 year with regular unprotected intercourse, see, each and every word is important in what I told. Regular meaning weekly at least 3 or 4 times a married couple should have intercourse when they are trying for a baby. And it should be unprotected. So they should not use any condom. They should try naturally. So if this is not working out after 1 year, then they should seek the medical advice. That is, they can meet the local gynecologist to have a basic workup. So the basic workup consists only of three main tests. One is whether because for conceiving we need the egg, sperm, uterus. This is the basic thing. So what the gynecologists check when a married couple comes to us is only the basic testing. Main thing is semen analysis for the husband to check whether semen is under the normal things. Second thing is whether the lady is ovulating properly. Every month whether the egg is forming and releasing. Third is whether the tubes are patent. Tubes, because tubes are needed for natural conception. At least one tube should be patent. And some general checkup like whether they are in the ideal body mass, sugars are normal, weight is normal, hormones are normal. Only this much is basic thing which is required. So once this 1 year I am telling us for general population. Suppose if you are falling under high risk category, if your age is more than 35 years, or if you had any surgery for cyst problem, any surgeries previously in your pelvis, all those things, or if your periods is obviously irregular, or if you have taken any treatment in the past like chemotherapy drugs, tuberculosis drugs, all those patients are at high risk. In those conditions, it is better you go to medical evaluation as early as possible.
In this treatment journey, at what time a couple should seek the support from a fertility specialist?
Actually, Nova, this is a very good question because this is the point I would like to enlighten for all Bangladeshi couples. Because first, when you have a medical help, when you have a complete basic checkup of whatever test I told, if things are all normal, you need not get alarmed. You can continue the treatment with the local gynecologist, follow the advices, all those things. Suppose in this basic evaluation, if they have found out some major issues like zero sperm count or both sides tubal block or severe endometriosis, or if you are taking prolonged treatment, see things are all normal, there is an entity called unexplained infertility. Around 15 to 20% of the couples, whatever the basic evaluation is done, all will be normal, but somehow they don't conceive. All these patients come under the category of unexplained infertility. These couples, sometimes they will wait for years together, 10 years, 20 years. They go to multiple doctors, do the same test again and again. Doctor reassures, so everything is good, you can wait, you can wait. But sometimes that backfires. In the sense the age is taking effect. After 10, 20 years of marriage, when they cross 35 years, 40 years, what happens is the age-related changes comes. Finally, when they come for some big treatment, the age issues has got some problem. So they can try natural treatment, all those things for some time, like 2 years or 3 years with the local doctors. Suppose if this is not working out, you have taken multiple treatments, then it is better to get an opinion from a first to go for investigations and treatment. Because switching over from the local checkup and treatment to a fertility expert, the timing is very, very crucial for success rate.
For conceiving a baby, how significant the age of the couple is?
See, again, age is the most important factor which determines the success rate for a couple who is taking treatment, who is trying to conceive either naturally or by treatment. Because we all know as age increases, the body becomes weak. Similarly, the female age is more important than the male age. Because females, ladies, moilas, they are born with a fixed number of eggs. So the egg numbers goes on decreasing. It is a curve like this. At the age of 20, the egg numbers will be more. 25 years, it comes less. 30 years, little less. 35 years, more. And at the age of 40 years or 45 years, it becomes totally less and it becomes zero at around 45 years or 48 years like that. So this is something irreversible. And second important thing is, not all ladies age in the same way. Suppose if I have two ladies of 35 years age, it is not that both will have same number of eggs. Some ladies with 35 years may have good eggs, but some ladies with 35 years, even though they are 35 years, they may not have that many eggs. So they may look as if they are 40-year-old. This is what we call as ovarian aging. And ovarian aging many a times does not correlate with the real age. So this is an important point to be noted. So you may think, oh, I am only 35 years. So why should I go for early treatment? Let me wait. No, you have to have a set of tests called ovarian reserve testing. That is to check how is your ovarian aging. If your ovaries are not too aged, then you can relax, sit back and wait for small treatments. Suppose if your age is less, but even though your ovarian aging is high, then you have to be alert. You have to achieve parenthood. You have to achieve pregnancy as early as possible. To check this ovarian reserve testing, we have some parameters like anti-Mullerian hormone, which is a hormone which is tested in the blood. Any time of a menstrual cycle, this test can be done for a female to check how many reserve eggs she is having in her ovaries. This is one important thing. Second thing is the antral follicle count, which is done on day 2 or day 3 of a menstrual cycle to check how many small follicles are there in the ovary. So they both are very important tests to check the ovarian reserve. And what I am talking now is, these are all ovarian reserves. That is, I am not talking about the monthly egg development. Many patients don't understand, madam, I am getting regular cycles. All my follicular study shows I am getting 1 follicle, 2 follicle. You are telling me my ovaries are aged. Why is it? Because the monthly egg development is like this month's egg development. I am talking a step ahead. I am talking about what is your bank reserve, what is your ovarian reserve, what is your future reserve of eggs in your ovaries. Because that is important to determine how long you have time. Suppose if your bank balance is more, you can relax and have small treatments, spend everything for luxury treatment, all this. Suppose if your bank account is very less, what will you do? You save your money for important things. So naturally this is, if your AMH and your antral follicle count is good, you can have small treatments, you can wait, naturally try, all those things is fine. But when they are coming down, then you should be alert, try to achieve the first pregnancy at least as early as possible.
Is low AMH condition is increasing nowadays?
Very good, because lot of patients, Dr. Nova, has got this low AMH problem. I told you anti-Mullerian hormone is a recently coming test which determines the ovarian reserve. So AMH, when we measure, many times when they have previous multiple surgeries or if the age is more, in all endometriosis, severe endometriosis, chocolate cyst patients, the AMH comes down fast. So as age goes up, the AMH reduces. That is the point which we know. But because of these multiple risk factors, even young age patients sometimes has got this low AMH problem. So low AMH meaning if the AMH is too less than 1, many people become frustrated. They think that nothing is possible, by my egg is totally gone, I can't conceive. And I have seen patients who have stopped even trying naturally because low AMH we can't conceive, madam, so we have not tried at all. So this is a wrong concept. The AMH less meaning that you have to be alert, you have to try treatment as fast as possible. But that doesn't mean that you will never become pregnant, because for conceiving you need only 1 good egg quality, 1 good quality egg and 1 sperm. That's it. So when the AMH is less, that means your egg reserve is less. So when we try with lot of antioxidants, coenzyme, a lot of treatments are available for AMH low patients. When you try with all these medicines, there are chances that you may conceive naturally, and we have seen lot of patients who have conceived naturally after mild treatment for low AMH. So people with low AMH, be alert but don't get depressed. Only thing is you have to have proper treatment at the correct time.
Thank you, Dr. Ramalingam. You said very nicely and clarified this issue. And another point is, in our country, there are a lot of myths about infertility. Like it's an issue of women only. Male doesn't have any role. And what is the role of husband in conceiving a baby?
Very good question, Noah. The main thing is the husband and wife both have got equal role for conceiving a baby. So baby issue many a times, even now common public thinks, oh, it is a problem with the lady. It is not like that, because male, female both can contribute equally to the problem. So the first step in evaluating a couple should be the semen analysis of the husband, because this is a very simple test, non-invasive test. The husband doesn't have much problem in having the test. If the test is normal and if the general condition of the male, suppose if he is not having any problem in having a normal intercourse and if the sugars are normal, then nothing to worry about him. Again, testing is not needed. But we have seen many times people, for ladies, they do lot of tests, ovulation induction medicine, tube testing, even laparoscopy. Finally, after 5 years, they find out that husband has got zero sperm count, which is a very, very bad condition. So we should evaluate husband at the starting only.
What are the treatment options for sperm problem?
See, sperm problem patients with one semen analysis report, we can't blame anyone like, oh, you have semen problem. No, we can't name them like that. So we have to have 2 consecutive semen analysis report before we come to any conclusion. So after the first semen analysis, we have some specific characteristics like the sperm count should be 15 million minimum. Motility should be around 40%, and fast progressive motility should be 32%. Morphology should be 4%. If the sperm semen is according to these criteria, then nothing to worry about it. Suppose if it is not, then you should have a complete checkup of the male to examine what problem he has, hormone checkup, examination to find out any other associated problem he has, whether he has got any varicocele, any previous surgery, smoking, all those we have to completely examine. At this point, it is better they go to a reproductive medicine specialist to have complete evaluation and treat whatever reversible problem which can be treated, and after 6 to 8 weeks, repeat semen analysis has to be done. Suppose if repeat semen analysis also showing the same problem, then we have to start proper treatment. Proper treatment in the sense, it depends on whether you have hormone deficiency or whether you have been taking any drugs for long time. All those things which is causing any sperm problem, we have to check and correct it. If the problem is mild, they can try antioxidant therapy and all those medical management. Suppose if the problem is mild to moderate, then you can try intrauterine insemination, in which the husband's sperm is nicely washed and it's injected directly into the uterus, which increases the success rate to a certain extent. In severe sperm problem patients, it is better they take proper advice and undergo IVF, ICSI treatment, which is the best treatment for severe sperm problem patients. And through this treatment, many males who are having very, very few sperm count are able to become father with their own sperm. And there is some even patients who have got zero sperm count, they also can conceive, provided we do TISA for them to find out the problem. Shukranu utpatti hochi na hochi dekar jonno, we can do all testing and take out the sperm and do ICSI with their own sperm and make them father of their own baby.
What about PCO or polycystic ovary and irregular menstrual cycles, and what are the treatment options, and are these diseases are increasing day by day?
Yes. See, polycystic ovarian syndrome, that is actually a hormonal problem. See, previously many patients had regular cycles, only few had irregular cycles. Now if you see, almost 30 to 40% of ladies have irregular cycles. This is because the weight gain is increasing. If the weight gain is increasing, if no physical exercise is there, the periods tend to become irregular for many patients. See, the PCO problem is basically a hormonal imbalance problem, and it cannot be permanently cured by any surgeries. So whatever we do, laparoscopy, all those things is a temporary measure to reduce the severity of PCO. So and second important thing is, not all irregular cycles is PCO, because some irregular cycles might be because of low eggs. So those patients have to be identified, because their treatment is different, PCO treatment is different. For PCO patients, you have first step of treatment for PCO patient is lifestyle modification, which is very important. Weight reduction if they are obese, changing of diet style, exercise, and stress reduction plays a very important role. Apart from the routine ovulation induction medicines we can give, injections we can give, laparoscopy, drilling we can do, and last step will be the IVF treatment for PCO patients. It is the last step. That means if no other treatment is giving good results, the last step of treatment will be to do an IVF ICSI treatment.
Some people suffer from endometriosis. What is endometriosis and what are the treatment options for endometriosis?
See, endometriosis problem is also increasing these days because of late marriages, delaying childbirth, all those things. Endometriosis, in one word to explain, it is basically a problem with retrograde menstruation. Whenever monthly periods comes, all the bleeding should come out of the jar. But sometimes what happens is, some patients, around 70 to 80% bleeding comes out, but around 20% goes back to the tubes and collects outside the uterus, inside the abdomen. This blood cannot come out. So it stands there for long time, and ovaries, uterus, everything gets irritated because of chronic blood, and there is chocolate cyst formation. So for endometriosis, laparoscopy is necessary to grade the endometriosis, clear the endometriosis as much as possible. Depending on the grading, for mild to moderate cases, you can try natural treatment, you can try IUI treatment, ovulation induction, all those things. In severe grade 4 endometriosis, it is better to go for IVF ICSI treatment.
Okay. And now I would like to request you to say something about tubal block. Many ladies suffer from tubal block, and is there any solution for them to conceive a baby?
The tubal block, for conceiving naturally, the ladies should have at least one patent fallopian tube. So the most common tubal test which is done is HSG. Suppose hysterosalpingogram doesn't show open tube, you need not get scared. You can't tell that you have tubal block. We have to do a laparoscopy to find the exact situation. In laparoscopy, if the tubes are open, then nothing to worry. Suppose if tube is blocked, we can try to do some laparoscopic cannulation tuboplasty procedure. But many a times for severe bilateral tubal block, tubal correction procedures doesn't help much. In those patients only, IVF has got a very important role. The success rate with IVF treatment is far better than tubal corrective surgeries.
What about IVF failure patients? You said something about IUI and IVF, and if it is failed, then what should be the option? What would be the options for those patients?
See, IUI is a simple treatment which is one step ahead of natural process. So we just inject the sperm inside the uterus instead of normal deposition in the vagina. But IUI success rate, we should understand, it is only 20 to 25% in the first 3 to 4 cycles. After 4 to 5 cycles, the success rate even comes down. So the next advanced treatment will be an IVF treatment, in which the eggs are taken out and the sperm's husband, whichever sperm he is giving, both are made to fertilize by keeping outside in a petri dish, and once fertilized, they are transferred back to the uterus. This is an IVF treatment. One step ahead of IVF is the ICSI treatment, which is especially good for severe sperm problem patient, in which we inject the sperm directly into the egg so that the baby forms, and this is transferred back to the uterus. So for ICSI treatment is the best for patients who have severe sperm problem, severe endometriosis problem, bilateral tube problem, and chronic severe PCO, not resistant to not working out with other treatments. All those patients, it is better to go for IVF ICSI treatment. And important thing which you asked is, what about when the treatment fails? Because I told you IVF ICSI is the topmost treatment. So even after undergoing this, suppose a couple has failed. What is their situation? Is the life gone? No, definitely not. Because the success rate with IVF is around 30 to 70% depending on the couple, the center where you get treatment, and the doctor who treats you. So it doesn't mean that all places IVF treatment is same. No, because you may get a same product from local also or from a branded company also, because the quality differs. Same way the IVF treatment, you may think, oh, it's all same IVF treatment, why should I do this again and again? No, it's not like that, because the IVF treatment is a very, very delicate treatment. You have lot of things to change in it. Suppose if a patient has the IVF failure, please don't get upset. It means that you have to go to a proper fertility specialist to troubleshoot what has gone wrong with your IVF cycle, why it has failed, whether it is the problem with the embryos, if it is egg problem or sperm problem or uterus problem or endometrium problem, all those things we have to troubleshoot. Again and again, same IVF, not useful. But when you properly troubleshoot, find out the exact problem, do the necessary correction. Suppose if egg quality is not good, we can change the injection. We can change the protocol of injections. Suppose if sperm is bad, we can change the sperm selection method used for ICSI. Lot of things are there. So all those can be done to correct the necessary thing, and then if you do, the success rate will be really good. And one more thing is, lot of advanced facilities are available for IVF failure patients, like blastocyst culture, in which the embryo is made to grow till
Now we are almost at the end of the program.
embryo transfer. We have laser hatching. We have embryo glue. We have okay, one minute. So
now we are at the end of the program. Would you please tell us? Would you please tell us in a very short form what for gynecological problem like heavy bleeding, fibroids, is there only hysterectomy is the only option?
No, see, we have lot of advanced treatment options, like even big fibroids, adenomyosis, big cysts. It can be corrected by laparoscopy, hysteroscopy without the need for hysterectomy. So before going for the decision, it is better we completely check, and you can have advanced treatment options.
Okay, doctor, would you please tell us some take-home messages for our millions of ATN Bangla viewers?
Okay. See, the main thing is, you have to, whenever you're trying for a baby, ensure that your general health is good, your sugars are controlled, your weight is under perfect range. And important thing is, I want to emphasize one thing, because now many people have started to have this more social media involvement. So they have phone all the time, do WhatsApp, Facebook, and they don't even have to time to try naturally. So in those patients, what they do is, only during the egg rupture time, fertile period, we try, madam. Rest of the time, we don't have intercourse. This is becoming increasingly common these days. That is a very, very bad thing which has not to be followed. because whenever you aim for a fertile period, you have
Dr.
lot of
Ramya
stress.
Ramalanga, we are almost at the end of the program. Thank you so much for your kind sharing with our viewers. I'm sure many people will be benefited out of this program and will find a light
One minute,
in the
no,
dark tunnel
so
of
the correct
infertility.
I will tell one last message for the ATN Bangla viewers. Correct treatment at the correct time in a correct place will definitely give parenthood for most of the couples who are watching this program. Dhanyawad.
প্রিয় দর্শক, এই ছিল আমাদের আজকের আয়োজনে। নিশ্চয়ই সবাই কিছুটা হলেও উপকৃত হয়েছেন। সবাই ভালো থাকুন, সুস্থ থাকুন, নিরাপদে থাকুন। ধন্যবাদ সবাইকে।